If you're counting down to a vacation, UW Medicine Infectious Diseases Dr. Paul Pottinger has 6 keys for healthy travel this summer.
Do I understand the health concerns where I'm going? That could be true domestically, but also definitely overseas. There are some infectious diseases or health concerns that exist overseas that we wouldn't normally think about. You can get with your medical provider and make sure that they are giving you extra supplies of medications for the things you might normally have to do at home, but also special travel-related medications. Really sit down and have a conversation with your travel mates and figure out what are people going to be comfortable with when it comes to masking indoors around strangers, when it comes to transportation getting around town, etc. If everyone has the same mental model, then it'll be a smooth trip. People don't usually like to surf the net looking for information about health when they're overseas, but it can be helpful to just keep your ear to the ground, so to speak, to make sure there's no new infections that are happening and that you understand what the transmission patterns are for COVID-19. Are you keeping your promise? Keeping your promise to the people you're traveling with. If there's an agreement that you and everyone in your travel group will cover your face when you're inside around large numbers of strangers, well, you should do that. Keep in touch with your own body. Figure out whether you're getting symptoms. Just because the vacation is over doesn't mean that the germs are done working. If you get symptoms of a respiratory infection, if you get a fever that you cannot explain, pay attention to that. Deal with it by getting in touch with your healthcare provider. Get in to be seen.